Alright. Alright. Let's wait for another 5 to 7 minutes for the others. But still, this is recorded on, yes. Puti na nung yes, no, we moved office. So right now, we have a new office. Kaya yung background ko is white na. Sorry, I just woke up. My English is still loading, guys, ha. Pagbigyan niyo na. You wanna see the new office? Gusto niyo ba? Share ko lang while waiting. So, like for the last 3 weeks, I have started my own team, office, whatever. I don't want to call it an agency, but I'll just call it office. Yes, so yeah, 3 weeks ago I started my own office. So currently I have five VAs working here, but night shift sila, no, their shift starts at 11. So they're still not yet here, but let me show you the office. So this is my office. One second. So this is my small space. So that's my big calendar-ish of the schedule that I have and my mess, my clutter always. Um, that's my notebooks for taking notes because I'm not too like I'm not too like nalilito ako sa like chat or like taking notes. And then here's my two monitors. And then this one is the other one. So both are 32 inches kasi one is simply not enough. And then the other one is my inspiration board so that you won't get lost of all of the kineme-kineme sa buhay. You know what kineme is precious? And then the office is here. There you go. So this is the first table, the first computer. And then the second and the third one are laptops. So two laptops there. And then another one there for another client. And this one here for another client. So like overall, every night we are servicing 7 clients, 7 to 8 clients. This is our small home office, and then that one is the comfort room, and that one is another monitor, and then our coffee table or coffee whatever is here, like this on the other side of my monitor. It's still messy, but here's our like big kettle, because coffee is a necessity. All right, and that's the toolkits. Our printers are outside because it's simply not enough space. So yeah, that's our current office right now. Yes. Yes. And so we just hired another client last week. Um, yun yung the one I posted on the chat. Yeah, so that's our current office right now. Puwede po ba mag-apply sa'yo, ma'am, for VA position? Right now kasi, Ma'am MJ, no, since we're still trying to see like how our workflow is, like the most efficient way. So we're doing on-site. So I still cannot hire, like I don't still have the capacity to hire remote workers. So wala pa akong all of them are on-site. Yeah, most of them kasi are friends and family. Ay, so currently, if there are like new open position, I won't be able to hire remote workers yet. I'm kind of hands-on with my clients, so parang nahihirapan kasi ako with remote workers because I didn't really have any like good experience when it comes to handling remote workers. I get scammed, I get cheated on, so Yes, two monitors. Now, when you're like working with clients, especially premium ones, you will handle a lot of data in one computer, or one monitor is simply not enough. Yeah. Thank you so much, everyone. Yes, I'm live. Thank you so much. Ayan. Walang food. Andun sa baba sa may kitchen area. Kasi pag dinala pa namin dito, wala na kaming space. But, andun sa baba. Ah, meron naman kami food. I-360 mo na yung malapit na. Malapit na. Mm. I have two monitors here, tapos nandito yung isa kong laptop kasi yung isa kong client nandito sa kabila. Ayan, flex ko lang. Charis! Saan located yung office niyo? Home office. Yes, it's a home office. Yung terrace namin ni-renovate ko to our home office. Kasi hindi na kami kasya dun sa kabila. Ano po mga niches ng VA mo? So one is fitness, health and fitness. The other one is data entry and case management. The other one is laboratory. Uh, the other one is insurances. The other one is insurances. And then the other one is logistics. Yeah, yeah. More on almost all of them pa rin is medical related because that's our niche, main niche. Thank you. Part po ba sa webinar ngayon kung saan links na mag-apply? Links are sa... unfortunately, no, because we'll be discussing about co-pays and co-insurances, so no. But definitely, MJ, on the training sessions, yes, ma-discuss yun. Since your VAs are in the same space, do they handle calls? Um, so only three of our clients handles calls. So the rest are non-voice. So yeah, there are medical VAs work that are non-voice, but I don't really advertise or guarantee it because it's rare or sometimes rare. Most of really the work that you will be applying to it have like a some sort of calls. Yes, noise canceling would work, but sometimes, we get angry, we get mad when talking to insurances, so sometimes it's a bit noisy here. Where can we get a recorded copy of this? We will upload it on our YouTube channel and then we'll share you the link. Do their voices clash into each other since they are in the same space? Yes, yes, they do. But when we like ask our like the person on the other end of the phone call, they said they don't hear it because all of our headphones are noise canceling. What headphones? This one? This one is brand new. Logi. So uh we have two Logi, one Jabra, and then my personal favorite, just headphones. For our laptops, just headphones. Yeah. This one I'm not too sure of the brand because it's my husband who bought this one. But I'll definitely share you the link if once I talk to my husband after. Yeah, I'm not really the one who buys our stuff. It's mostly my husband because he's more techie than me. I'm just the one who use it.
Just the
Yeah.
one who use it?
Yes. Really. Thank you so much. All right. All right. Thank you so much. Thank you. All right, let's start. Okay, so our topic for today is collecting copays and co-insurances. Okay, this is a free webinar. Okay, anyone can join, and then after this is recorded, no, once the training is done, we will upload it on our YouTube channel, and then you can freely watch it afterwards. All right. So, if for some of those who don't know me, let me give a short introduction. My name is Jen. I'm a registered pharmacist by profession, but I did not practice. I started a virtual assistant about 4 to 5 years ago, and I'm really sorry if my voice sounds maarte, but um, I'm actually not. I'm actually not. This is ang hirap kasi mag-English eh. Okay, but ayan. So I've been communicating with US people for about 4 to 5 years, but I'm still not that fluent. So if it sounded maarte, I'm really sorry. It's not my intention. All right. I just wanted to clear that up. Okay, so objectives of our webinar is to understand the differences between copays and co-insurances, and then learn the best practices for payment collection, and then explore tools for managing collections, and then improve communication skills around the billing. Okay, but disclaimer, okay, this one is just for collecting copays and co-insurance. This is not the whole billing process, huh? Just for copays and co-insurances. All right, since I think this topic is not much like explored in our training session, so I would like to cover it as much as I can. All right. I'll give you some example later. I prepared like 8 cases, okay, that you usually encounter when collecting copays and co-insurance. Okay, so first we need to understand what copay versus co-insurance is. Okay, so copay is your fixed amount paid by the patient each visit. So let's say, for example, that patient is going to an office or a primary care or a specialist, they have a fixed amount. But for the fixed amount, it doesn't mean na, for example, one patient, like patient A pays $25 for office visit. And then that doesn't mean that patient B will have to pay the same price. Okay, even though it says fixed amount. All right, fixed amount based on the policy that they bought. Okay? And then co-insurance is a percentage. Let me give you another example so that you can see what I'm pertaining to. All right, this one. So this one is your plan. We call this a plan summary or yeah, a plan summary. This is the patient's medical sample of a patient's medical benefits. So let's say patient A, this one is the plan that she bought, he or she bought. All right. And then on his plan, what was contracted by the insurance or what she bought, she has a deductible of 1,500 and a 3,000. Okay, maximum out of pocket 7,000 and then family is 14,000. Primary care visit $20 copay, specialist visit $40 copay. But sometimes you will see, okay, primary care visit 80% co-insurance, 20% co-insurance. All right. And then on this plan, you will see 2 tiers. All right. Sometimes there are plans or there are policies that have 2 tiers, especially Blue Cross Blue Shield. Marami ang tiers. Okay, let's say patient A. When you do verification of benefits and then that patient, no, sabi sa'yo ng representative, that patient is on tier 1. All right. That means that when that patient goes to a certain visit or goes to a certain service, the tier 1 will be his or her coverage. Okay, so patient A, tier 1, pumuntang primary care visit, that patient will pay $20. But for example, patient B goes to a primary care and that patient is on tier 2, he or she will pay $50. All right. Fixed amount per your contracted or per your policy. Kaya baka kasi, no, you will like think or you will have that initial thought na fixed amount, ibig sabihin fixed amount for every patient. Okay? It's a fixed amount paid, but it will depend on the patient's plan. Same with your co-insurance. Percentage of the cost that the patient is responsible for after the insurance covers its part. But you have to take note when it comes to insurance, all right? It's once your deductible has been met. All right? But if the deductible is not been met, coinsurance will not take place. All right, you will see this term. Okay, 20% coinsurance after deductible. So let's say that patient has a 1,500 deductible and that patient has not met his or her deductible. The patient will pay how much? What do you think? How much?
Ano po?
So for example, a patient has a 20% coinsurance after deductible and that patient went to get an x-ray. All right? And he or she has not met his or her deductible. How much will the patient pay?
$20.
He or she has not met their deductible, huh?
Ah, okay.
100%. They will have to pay 100% because they has not met their deductible.
Mhm.
Okay? Pag may co-insurance ka kasi that doesn't mean that the insurance will cover 80%. It is after
Deductible.
deductible. They have met their deductible. That's why we have this deductible. Let's say their deductible met so far is only $500. They will have to pay still $1,000 or like 500. And then once they met their deductible, that's when the insurance will cover 80%. All right. And then for example, your co-insurance is like 20%. And then you have met your deductible, meaning um that the insurance will now cover the cost, say 80%. But there's the possibility that that 80% can like pwedeng ma-cover ni insurance 100% once the out of pocket has been met. Medyo magulo ba? A bit confusing? Medyo confusing kasi when it comes to co-insurance. All right, so let me summarize co-insurance percentage of the cost. So let's say the cost is like 80%, 20%, meaning 20% patient responsibility. Okay, but if the patient has not met the deductible, that patient will have to pay full price. But if they have met their deductible, the insurance will cover 80%. They will have to pay the 20% patient responsibility. But once the out of pocket has been met, this one, the insurance will cover 100% of the cost. Gets ba? Gets ba? Any question? Yes, it depends on the patient's plan. That's why we do verification of benefits. Yes. All right. The importance why we collect co-payments and co-insurance at the time of service. Number one is to improve cash flow for your practice. Still, this is even though we cater patients, we service patients, we are still a business. All right? May instances ba na walang copay si patient? So translation, are there instances wherein the patient does not have a copay? Yes. You will see there, or the representative will tell you it's 100% covered, no co-insurance, no copay. All right, this one is done. Reduce the risk of unpaid balances. Okay, so this is the least or the worst case scenario, no? Unpaid balances. As much as possible, we would want every payment collected and every balance taken care of. Kasi, okay, that clinic will go or will declare bankruptcy if not, and then they will fire you because they don't have any money to pay you. Okay, we don't want that happening. Okay? Ensure compliance with insurance contracts and then foster transparency and trust with the patient. Okay, once the patient is fully aware of what his or her responsibility is, of course, 'di ba? That will calm the patient, or at least that patient. Kasi 'di ba they have that bill, or they have that law wherein the patient still need to be notified of what his or her responsibility are or is. Okay. So best practices on how we can, okay, maximize our payment collections and as well as reduce unpaid balances. The first step that we need to do, the most important one, is to verify patient eligibility and benefits before the visit. All right. So how do we do verification of benefits for my students out there? How? How? So we have two ways of getting patient eligibility and benefits. What are our two ways? Provider portal and call insurance. Very good. Portal or insurance. All right, so let me show you. Okay, so using calls, we do have that sort of format that we follow, okay, for us to get the benefits. Okay, for example, we have to like ask if we are in network or if we are not in network. That's very important because in network and out of network have different coverages. All right. So this is the format that I use. Now it's up to you if you will use it, but if not, that's totally fine. Okay, this is the easiest format for me to use. Okay, so I start with checking if the provider is in network or out of network, and then I check the policy dates. Policy dates is the eligibility dates. Okay, from like the start of their contract up until current. Okay, covered, like what are the coverage of the patient? Let's say, for example, that patient has $20 copay. How do you see or like how do you input covered? Like what will you say on the coverage? It's gonna be 100% covered after copay. It's because your copay is the fixed amount that you will pay for each visit. Once you pay that copay, it's gonna be 100% covered by the insurance. All right? But copay and coinsurance, no, you will rarely see both of them. It's either of the two. Once charot. Once the representative like tells you it's gonna be $10 copay, okay, that would automatically means 100% covered after copay. They won't give you the co-insurance and the deductible because it will not apply. And then if they gave you the co-insurance, they will not give you the copay and out of pocket. It's because it's not relevant. Okay, copay, okay, is directly connected to our out of pocket. So let's say the patient has a $10 copay. So that means it's 100% covered after copay. But once you have met your out of pocket, you won't have to pay copay anymore. But if they gave you co-insurance, like 80% co-insurance, 20% patient responsibility, it is directly related to your individual deductible. Okay, it's because if you have met your deductible, that insurance will cover 80%, but if not, the patient will cover 100%. All right. Payer ID, I need to get this information with the insurance is because it's very helpful to determine which payer we will send the claims to. Okay? Because sometimes they're big companies, big insurances like Blue Cross Blue Shield or other companies, they have different departments and they have different payer ID to submit the claims to. Okay? Yes, Blue Cross Blue Shield is a company. It's an insurance company. All right. Payer ID, they will give you like a sort of code. Like, for example, a code 66627. Okay? And then once you input it to your EHR, it will like a connected insurance it will show there. Is there any instances that both copay and coinsurance is applicable in the plan of the patient? Yes, there are, but that's a very rare case scenario. There are. You have to pay both coinsurance and copay. But most of the time, like the common ones when you do verification is either copay, out of pocket, coinsurance deductible. But there are. Okay? And then once I get all of that information, I will have to ask if authorization is required. Right? This is also very important. It's because, okay, once it is required, we have to file one before that provider can see the patient. All right. And then last one is your call reference number. Okay, this one naman, no? Uh, the importance of getting the call reference number is just to have like sort of evidence that you called this patient and this is what they sorry, you called this representative and this representative gave you all of this information. Okay, they can track the call. The call is always being recorded and they can track what happened during that call. All right. The next one is using portals. Any question when it comes to using calls before I proceed to using portals? No question. Okay. So using portals, now we do have different portals, okay, that you can use. Okay, some of the portals that I have used before are One Health Port. So see One Health Port, they have different participating sites. Okay, which means these are the times that or these are the insurance. Sorry, I was looking at the at that time. These are the insurances that are connected with One Health Port. So if you wanted to check the coverage for a certain patient with Cigna insurance, you will go to this platform. But again, no, there are other platforms as well, like Navinet and other platforms that have the ability to check for insurances. So these are just the ones that I had experience with. Okay, you can also check the Cigna portal, the Pacific Source portal, Providence, United Healthcare, Availity. So I'm gonna use Availity as an example. No, this is the login for the Availity. Okay, it's two-step authentication. Okay, and then once you get into the portal, this is what you will see. Okay, and then if you wanted to check eligibility, just have to click eligibility and benefits. Yes, you need to have VPN to access the portals, especially Availity. Cigna, yes. And then once you click eligibility and benefits, and then you input the information like the organization, the payer, provider, patient name, patient date of birth, and then it will generate like the benefits of the patient. But if it doesn't, something's wrong. Like it's either your name is wrong, your date of birth is wrong, your address is wrong, provider is wrong. Okay, a lot of things. And then once you will see, okay, once you entered and then the system was able to find that patient, you will see the benefits, just like what I showed you earlier. Okay, this one is redacted. It's because of HIPAA. This is an actual patient. You will see, for example, for podiatry, that person has a deductible of 950 and remaining is 532. Okay. Like see, annual deductible 950 for calendar year, and the remaining is 532 and 34 cents. Sorry, this yeah, remaining. All right. And then for other coverage, for example, like surgery or this one is surgery, you'll see $20 co-insurance per visit and there's no copay. Okay, and then you'll see an authorization, no auth required. Okay, so that's an example of verification of benefits using the portal. Any question? None? All right. And then we collect payments at the front desk or during telehealth check-ins. So sometimes providers prefer it before check-in, sometimes providers prefer it after check-in, after like the certain visit is done. Okay, so for the client I'm currently servicing or providing services to, we collect copays and co-insurance after the visit. Okay, use point of service collection tools such as your credit card readers and online portals. No, EHR nowadays are very sophisticated. They have like integrations with Stripe or any other payment tools. Okay, and then we also train our staff to handle payment conversation, like letting the patient know um, that their card declined or how much their responsibility are. And then sometimes, there are patients that have or are having financial difficulties. We offer flexible payment options, sometimes payment plans, but sometimes we do cash, credits, something like that. Okay. So payment tools, what are some of the payment tools that we use commonly? Number one is your EHR system. Okay, so most EHR system, like I told you earlier, they have the capability to collect copays and co-insurance within the EHR system. So right now, we use the EHR Simple Practice, okay, to collect those copay. And Simple Practice, the patient's credit card is connected to their portals or their patient's profile. Okay, practice management systems, and your patient payment portals. Okay, payment options, you have your, kindly mute your mic, please. Payment options, you have your credit or debit cards, right? You have your cash. Okay, but since some of the facilities nowadays are telehealth or there are those facilities that offers telehealth service, of course we cannot do cash, diba? So we do credit, debit, mostly credit cards. Okay, check is a less common, very rare. I haven't encountered a check yet. Online payments, yes, there are, and mobile payments like PayPal or mobile wallets like Apple Pay. But mostly credit, you'll see credit card. I'll show it to you later. Yeah. We do sample cases. Before I do sample cases, any questions so far? Wala. All right, that's good. Okay, so sample cases. Now we'll start with our schedule. Okay, so of course, once you go to the chart, you will see the schedule. I'm so sorry, these are redacted because it's an actual EHR. Okay, just wanted to show you a feature of simple practice. So when they input on a certain appointment and that appointment is done, in here you will see new clients, incomplete documents, unpaid by client, and then insurance. This is a good filter tools that they have. Okay, but since on my end, I only collect those unpaid by client, meaning those co-pays and co-insurances, I filter it by unpaid by clients. Okay, you will see other appointments in here that is unhighlighted, meaning it has been collected. And there are those that are unheighted as well. It's because the insurance will be covering the cost. Okay. And this is how it would look like in an actual chart. Okay, once you go to the chart, this is your patient information, their date of birth here. This is the chart notes, their past appointments, and their progress notes. In here, you will see like the billing side. Okay, the insurance of the patient. So this patient, Jason, is have United Healthcare Oxford. Okay, and then his or her client information, his or her information. Okay, so we proceed with our case number one when collecting copays and coinsurance. Okay, so when I look at the chart of a certain patient, okay, I will see Andrea, and this is Andrea's benefit. Okay, this is the verification of benefits that I did before Andrea was seen. Okay, so Andrea is in network, insurance is in network. Her policy dates are 04/21. This is the start date up to present, meaning she is still covered. Okay? And the insurance representative gave me copay of $25. That means that the patient is 100% covered after the copay. Andrea has an individual deductible of 2,500, and what has been met so far is only $5.95. Family out of pocket is 5,000, met so far is 57 and 71 cents. Payer ID is 22099. How is it important 22099? Makikita nyo dito in the primary. Okay, you will see here. Okay, once I search for a certain insurance, okay, I can just search by payer ID. Okay, so payer ID 22099 is connected with Horizon Blue Cross and Blue Shield of New Jersey. Okay, it's easier to just see because they're in every EHR they have like a database of insurances, and sometimes it's incorrect. And when you submit the claim, it will come back denied. It's because it has been submitted to a wrong payer. All right. So this is what Andrea's benefits are. Okay, and then when I look at Andrea's billing, okay, this is the billing side. Overview is where you will see her progress notes. Billing is where you will go if you want to collect his or her payments. So Andrea has a visit on October 8th. Okay? And this is the code, CPT code that the provider used. Okay, so when we search for CPT code 90837, okay, you will see that that code is for psychotherapy 60 minutes with patient. All right? It's connected to a certain code. Okay, and then the fee is 200. What you will see, okay, this one is not entirely correct. This one is a default one. Okay, they have their own contracted fee with the patient's insurance. Okay, especially if they are in network. So since this patient is in network with the this provider is in network with the insurance, the patient's insurance plan, meron silang contracted rate. Okay? And the contracted rate for 90837 is 137 and $26. Okay? For 90791, let's see, 90791. When we search for that CPT code, okay, it will show you, um, not this one, psychiatric diagnostic evaluation. Okay, so this is their first visit. They had a psychiatric evaluation um, on September 10. Okay, and then you'll see here the fee is 200. Okay, meaning this is incorrect. We have to correct it so that once our team submits the bill, it is correct. All right, and they don't have to spend time to correct it. Even though our only responsibility is just collecting the $25 copay, as you can see, we've collected it. This one is paid by the insurance. Okay? So what I will do is I will correct this first. Okay? Because as you can see, we have billed the patient for a 90837 for only 137. But since this one is 200, we have to amend it. Okay, how do we amend it? Okay, first we will go here in the new tab, and then, sorry, this is how we will invoice. But since we have to correct it, this one is the one that we will click, the manage one. Manage. And this one, we'll click the manage. And then edit details. We have to edit it. We have to correct it. Okay? And then this once you click the edit, this will pop up. Okay? Type is insurance, meaning we will bill the insurance. The client owes only $25 because this is her copay. Okay? And this is you will see 90837 is their psychotherapy 60 minutes, and the fee, so instead of 200, it should be only 137 and 26. Okay? And then we will correct it, and then click save, and then it will now appear as 137 and 26. Okay, it doesn't matter to us since this patient has a copay. Okay, we will only have to collect $25 and then the rest will be 100% covered by the insurance. Okay, so what we will do once we have corrected it, okay, we will click the new, okay, we will click the invoice because we will now invoice the patient, okay, and then it will create like this. Psychotherapy, 60 minutes with the provider. Insurance type, $25, the one that we will collect. And then we will click create invoice. And then this one will show you, like this is the template of the invoice. This is the bill to the patient, provider, supervised by, your date of service, your description of the service, and the amount. Okay? And then once you save it, this one you'll see save at here. Once you click save, it will prompt you to add payment. Okay? Once you add the payment, it will show you payment methods. Okay? Online cards, cash, check, or external card. Okay? We will click so in the service that I'm providing to, or in the clinic that I'm practicing with, or like in, I'm sorry. Okay? We collect via the card. So this one is the one that we will click. This is their card. MasterCard ending in blah 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 7/20/29. And then what I have to do is I just have to charge the patient. Click charge, and then this is the invoice. Makita nyo, it's already paid. Okay? And then once you see on the chart of the patient, it's paid. Okay, meaning simple practice, charge the patient. So now it's showing as paid. Okay, so question from Mags. Okay, where is the information for the deductible? Okay, like I said, when I tried to get the insurance verification, let's say here for case 2. When I tried to get insurance verification, once they gave me the copay, the deductible will not apply. Okay, you will rarely see Okay, you will rarely see that they have both. The insurance representative will tell you if it's copay, coinsurance, or if it's both. For most cases, like common cases, usual cases, it's only one or the other. It's either copay, 100% covered after copay, and if they gave you the copay, all you need to get is the out of pocket. Okay, but if for example on our case number 2, you will see here, okay, that coverage is 60% covered after deductible, meaning the coinsurance is 40% patient responsibility. Okay? And then the individual deductible of is $2,200. But you will see here that they have met their individual deductible. Okay, once they have met their individual deductible, the insurance will cover 60%. Okay, and all they have to pay is the 40% of the cost. Okay, so for our case 1, Okay, you'll see I did not get the deductibles because it won't matter. Even if I input there the deductible, it will not matter. Okay? Copay doesn't count in the deductible. It does. It does count. Deductible info is not longer relevant if you're getting the copay or if they gave you the copay. Because like what we said, copay is a fixed amount they have to pay and the rest will be 100% covered. So if they pay $25, the rest will be covered 100%. This is only their responsibility. Okay? And once they have met their family out of pocket, that's why I get the out of pocket here. Okay? But once they have met their out of pocket, they will no longer have to pay the copay. All right? But for case 2, let's say this one is a co-insurance, right? Okay, 60% covered after deductible. Okay, and they have fully met their deductible, meaning now the insurance will now cover 60%. Okay, and then you'll see here for 90837, the cost is 137 and 26. We will have to check, okay, 137, 40% of 137.26. This is your 54.90, 54.90.
Um, Question, coach.
Yes po.
Since it's copay and co-insurance, and does it mean we don't really need to check the deductible of the patient
So
once the
once you
copay?
verify the benefits, the representative will usually say deductible does not apply.
Mm,
Once you hear that, okay, you don't need a deductible. It's because it will not apply.
mm. Copy, thank you.
Yeah, and then Ed says, because hindi sinabi copay after deductible, very good. We will say copay 100% covered after copay, meaning 100% covered after the patient has paid copay. But for this one, 60% covered after deductible, meaning once they have met their deductible, they are 60% covered. All right. So 54.90 is the 40% of the cost. So that is what we have to collect to the patient. But let's say, for example, they haven't met their deductible. How much should we charge the patient? 100%. Very good. You get the idea. Okay? So for deductible, usually, if they have met their deductible, if they have fully met their deductible, they will also give you the maximum out of pocket. Because once you have met your maximum out of pocket, and if you have a deductible, you once you've met the out of pocket, you will not pay anything. It will be covered 100%. Once deductible and out of pocket has been met, you don't have to pay anything, or the patient doesn't have to pay anything. All right, and then we will do the same. We will just have to, okay, create the invoice. Okay, and then since it's already corrected, just create the invoice and charge the patient. Same process as what we did earlier. Okay, case number 3. Okay, let's see. For this patient, it's already 100% covered after copay, and uh, that patient only have a $30 copay, and an individual out of pocket is 7,560, and they all have met $90 so far. So meaning they will still have to pay the copay. So as you can see here, in the billing, they have an appointment October 8th for code 90837. The fee is 137 and 26. They will only have to pay $30. Okay, the insurance will cover the rest. Okay, and then we will do the same. Okay, just create the invoice and then charge the patient. Case number 4. See? Okay. 100% covered after copay, $10. Okay, individual out of pocket has not been met, has not been met. All right, authorization is not required, so we'll only have to bill $10. Okay, but what do you see that's wrong here? What do you see? What's wrong with this case? What's wrong with this case? What can you see that's wrong here? What's wrong? Wrong input of the fee. Okay, so even if you're only doing copay, no, it will be beneficial for your team to have it corrected so that they can just submit the claim. Okay, so again, we just have to correct it and then bill $10. Okay? But if it's, for example, if it's co-insurance and the fee is wrong, of course, your calculations will be wrong. So you have to correct it still. Okay? Case number 5. Let's see. 100% covered after copay. This one, as you can see in my notes, this does not, wala siyang call reference number. Doesn't have a call reference number. It's because this benefit came from Availity. Meaning, I got this information from Availity. Okay? But still, October 8, 90837, 137. What do you think is wrong with this case? Case number 5, what do you think is wrong?
It says copay is $15, but there in the invoice is 137.
Yes, very good. Okay? Wrong yung pag-input ng information. Kasi what it says on the verification of benefits, okay, the patient will have to pay $15. And why is it showing as 122? Okay? So we will have to correct it. Okay? So sometimes we do write-off. Okay? So parang write-off, reduction of the cost. So sometimes, ina-out of the books na lang nila. Um, parang inconsistency with the billing, pero it's not that like large amount. So they disregard it because the claim has been submitted, the patient has been charged. Parang ganon. Note to self zone out. Okay. So we will have to correct it. So how do we correct it? Okay, we do the manage. Okay, edit details. Okay, and then you will see, pag self-pay kasi usually nag-write off siya. Okay, so you will have to change it to insurance. Okay, because the insurance will cover the rest and the patient will have to cover $15. And then save. Then you will see it's now corrected. $15 for the patient. Sorry. 122 or the rest for the insurance. And then just bill the same. All right. Case number 6. Let's see. Case number 6 is a no-show. You'll see here, red mark, no-show. So sometimes when it's no-show or late cancel, they sometimes charge it. That's what we call late cancel fee or no-show fee. But for this instance, no, for case number 6, you don't have any fees. Okay, no-show, no fee. All right, but there are cases wherein there's a fee. Okay, they have their $100 fee or $80 fee, whatever fee that they have for the no-show. It's because we have reserved that spot for this patient. And if they no-show, they won't get paid. Okay? And that's a loss for us. So that's why we do no-shows and late fees.
Are they covered by the insurance?
No. As you can see, it's on the client's side. The
Mm.
patient will have to pay it out of pocket. Okay, but take note for no-shows and late cancel, if they are Medicare, Medicaid patient, you will not charge them. It's illegal. May nag-vibrate. Pa-mute na lang po. Alright? Okay, take note ha, for Medicare, Medicaid patients, as you once you like encounter Medicaid and Medicaid, they usually covered by insurance, right? So for Medicaid, there are those um for Medicaid, what are the patients for Medicaid? Like what are the like requirements for them to be qualified for Medicaid? Low income families. Very good. How about for Medicare?
Above
Is
above
flat
65 years old.
above or with
5 years
disability.
old above.
Wala ko narinig. Sabayang pagbigkat, chares. 5 years old. And
Go, Precious.
nagkano, we don't do, ano here, ha? Diyos ko,
Chorus.
sabay-sabay kayo. Naluka ako, hindi ko nag-gets yung information. Alright? Then those 65 above and those with disabled. It's illegal to charge them, no show, and late fees, ha? Huwag niyo i-charge. Okay? That's one of the mistakes I did when charging. Okay, ba when I see like someone no showed, I charge. Pak, 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 charge. But afterwards, I know I was informed that it's illegal to charge for no shows, especially for those Medicare and Medicaid. So don't do that. Hindi naman. Napakiusapan pa naman yung pasyente. Mm. Gigil na gigil kasi ako mag-charge eh. So, when I saw okay, no show, charge. But, it's illegal. Okay, last case for today is okay, andyan yung inyong patient and then you charge that patient. Okay, but the payment could not be saved. It's because the card has either declined or have insufficient funds. Okay, so we won't be able to charge the patient even if we wanted to. It's because their card declined or they don't have insufficient funds, or the card number is wrong. The CVV is wrong, something like that. Something does not match. Right? So, of course, we do patient communication. Okay, we communicate with the patient. Sorry. If they're asking regarding copays and co-insurance, of course, we explain to them what are their responsibilities. If it declined or if it like insufficient funds, we communicate with them. Okay, it's also like our responsibility is because if we don't inform them and then it will pile up, okay, mas malaking problema yon. It's gonna be a bigger problem. Okay? Yes. All right. It's the facility. Okay? It's the facility that will be responsible. That's why hindi nila ako nakasuhan. Okay. Okay. Okay, so for example, based on your insurance, your copay today is $30. We accept cash, credit, or debit. Or you have a co-insurance responsibility of 20% for today's visit, which comes to $50 or whatever that 20% is. Okay. Handling non-payments. Okay, so it's also one of the responsibilities of the revenue cycle management to handle non-payment or those patients that don't pay. Don't pay. Okay? Kasi sometimes even if we send timely reminders or messages or calls, they can just ignore it. Okay? So we reach out to offer payment plans. For example, okay, installment, ganyan. Okay? Anything or any techniques or strategies we have to do for the patient to pay. Okay? We send it to the collections department para siyang home credit or Shopee na napakakulit na mag-collect nung payment for us. Okay? Yes, forgives. Yan yon, yung mga pasyente na yan. Okay, Q&A. Malapit na tayo matapos. This is our last slide. Q&A. Any questions? Marami ba ang natutunan for today's video?
Um,
Yes po. Question.
um, Coach, yung Copay at saka co-insurance, is it one of the role of med-VA or may cases na yan lang talaga ang trabaho mo?
It will depend. It will depend. Most med VAs, no, you do admin stuff. Sometimes you do insurances. Sometimes you do minor billings like this. This is just minor. Hindi pa kasi ito yung actual medical billing. Still, this is one of the admin tasks, but not all medical VAs have this task.
Thank you.
Any question? Ah,
Yes, coach.
yes, yes, Precious.
So if you call the insurance company
Mhm.
and when you get the details for the patient and they don't tell you about the deductible, like if they don't say deductible does not apply, that means you have to charge the patient for the full cost, because if the patient has not met the deductible, the insurance cannot pay. So you have to charge the patient for the full cost of the service. Is that right?
So if you call the insurance and then they will tell you the deductible does not apply, it's either the patient has or is 100% covered or that patient has a copay. Okay? So before we charge, we have to know if it's a copay or if it's a co-insurance. Okay? So if the insurance representative gave you okay $10 copay, um and then deductible does not apply. Okay, but for copays, you have to get the out of pocket or the maximum out of pocket. Okay, and then for copays, you have to charge the copay. But if it's for co-insurance, let's say the representative told you 80% covered, 20% patient responsibility. Once they gave you a co-insurance, okay, they will automatically give you the deductible as well. Do you get what I mean?
Yeah, thank you.
Yeah. All right. Okay, it's either copay or coinsurance, and in rare cases, both of them. Okay, and then remember, copay is connected to your out of pocket. Your coinsurance is connected with your deductible. Okay. So this one, okay. What's this, Mag? Is this like just a translation or an explanation?
I'm just transcribing, Coach.
Oh, okay. Okay. That's right. Okay.
Sorry, coach. You
Mm-hmm.
said co-insurance is connected to the deductible.
Yes.
So if, example, you have a co-insurance of 20%
Mm-hmm.
and the patient pays it, you don't add it to the out of pocket. Is that what you're saying?
So insurance, once we submit the claim and they paid for that 80%, it they will like on their system they have like some sort of tracking. It will still apply to the out of pocket.
Okay, yeah, thank you.
Mhm. Okay. Any other question?
Coach, good evening. Question po. Sorry. Sorry na nga. Sinadya ko yun, Coach, kaya matagal na tayong hindi nag-uusap eh.
Kaya nga. Sige, let's go.
Okay. Question ko, Coach. Out-of-pocket maximum is yan yung accumulated amount na binayaran ni patient for the whole year po?
For
Or for the plan?
so it's when you see it, you will see it in the word out of pocket. The
Yes.
patient pays out of her pocket.
So that's the
So
maximum.
anything.
Like for example, out-of-pocket maximum niya is 5,000 for a year, like that ba? And then yung binayad niya na copay, yung mga deductibles like that. So accumulated yun, doon ano natin sa out-of-pocket.
Yes.
Okay.
Yes.
Then po, Coach, after ma-meet natin yung out-of-pocket, the maximum, the insurance will pay the whole amount na pag if ever there will be ano, no? And then, ano
Yes.
yung annual maximum, Coach?
Annual maximum
Yung
out of pocket?
hindi out-of-pocket. Paano ko ba yun sasabihin eh? Yung bang, yun lang ang limit na babayaran ni insurance for the whole year. Anong tawag doon?
Coverage, insurance
Yes,
coverage?
policy
Parang ka
exhaust.
ng out of maximum coverage yata? Ganon?
Parang policy exhausted ata.
Okay. So si policy, paano yun?
Ano,
May instance ba na, Coach, na naubos yun talaga? Like in a year?
siguro if the patient like have a lot of surgeries, but most of the time wala naman.
Okay. So there is
So
no...
like from my personal experience, I haven't encountered a patient that had like an annual limit or
Okay.
uh,
Sige po. Nagpicture na ako dito. Salamat po!
okay.
Loli, I'm sorry, but please repeat all the conversation in English, please.
Okay, that concludes our session for binaba na kagad. What EHR program did you use in those cases? I'm planning to explore it and just wondering if I can use it personally. This is called Simple Practice, and yes, you can use it personally. Okay, it's called Simple Practice, this one. And yes, you can create your account or like you create a sample account. Simple Practice.
Can they be used free? Like, do you have to start working before you use it, or you can sign up free?
Yes, you can start your 30-day trial. Just click this link and then sign up.
Coach, quick
Yes?
question.
Mhm.
Ano po yung pagkakaiba or difference between ECW and sa AHR?
So ECW or eClinical Works is also an EHR. So I don't know what's your question, but it's an EHR.
Okay.
Okay, so it's a largest cloud base. So this one is the leading. So far from what I can see on my research, this is the leading EHRs out there. Next will be like your Practice Fusion, Simple Practice.
Same pa po sila po, Coach, yung EHR at saka yung ECW. Parang,
Yes.
okay. Nakikita ko kasi nila na dapat that the tools dapat marunong ka daw sa EHR.
Yes. There are a lot of EHRs out there. So when I apply to different job posts and then they like see or like have a requirements that EHR knowledge or something like that, I usually state what EHRs I'm familiar with, such as Athena, like this one, Athena, Practice Fusion, Simple Practice, something like that. I mean, it's impossible to know every EHR out there, so you can like list out a couple and then they would be able to like gauge that you have an experience with handling EHR.
Yung simple practice po, Coach, is it EMR or EHR?
So there's not really like a or like clear definite like difference between an EHR and an EMR. So yeah. Yeah. And parang generic daw ang ano.
Sorry.
Generic. Yeah, go ahead.
I'm a transcriptionist, so if you know the software for EMR, it doesn't have all these tools that go with EHR, the the insurance, the phone, the portal, the emails. You don't have that in EMR. It's only purely about the medical record and
So
the
there you go.
demographics and stuff.
There you go.
I think so also. It says EMR is it
Medical
cannot be shared.
records,
It's just within the practice, and then yung EHR is shareable
cloud-based,
daw.
shareable. That's great.
Yes, correct. Internal ang EMR.
Mm, there you go. Okay. Is there an instance that copay does not apply to the deductible or it does not apply talaga? What do you mean? It does not apply or it does not count? What do you mean? Accumulative? Uh, so for copay sa deductible niya, mm, I think as per billing training it apply. Oh yeah. So sinagot na ni Sebi. It does not apply for copay.
Kasi ano coach 'di ba? Parang ay sorry, sumagot.
Go go
Hindi,
go go.
hindi kasi 'di ba? Kaya natin sa binabayaran natin yung copay co-insurance unless may specification dun sa policy na merong special indication dun sa policy na magbabayad ng copay. Babayaran natin siya after we meet the deductible. So, it doesn't apply dun sa, hindi siya na-accumulate dun sa deductible. Nag-accumulate siya dun sa out-of-pocket maximum. 'Di ba? Tama ba?
Mm.
Yun.
E.
Yun po.
I think yung
Alrighty.
insurance lang ata ang nagka-count sa deductible.
Okay, sige. English pala to. Ano nga pala? Sorry.
Yes, Sevi, ano ba?
So it doesn't apply with the deductible because well, based on what we follow, so we only paid we only the patient only pay the copay or the co-insurance after they meet the deductible. So basically, if they are still in the deductible phase, they still have to pay the 100% of the cost. So or depending on the clinic, how much if they will have a rate. Actually, in our clinic, we don't ask the patient, just to share. In our clinic, we don't ask them to pay the 100% of the cost. There is like a rate for the deductible, like $150, something like that. But there would be clinics that would ask for 100% of the cost. So once they reach the deductible amount, once they satisfy it, that is when we start charging the copay or co-insurance, depending on the plan. And then it will accumulate with the out-of-pocket maximum.
So question daw. Question?
Yes.
Hi, coach. If the case, sorry, this is another case. If the
Ay,
case is the patient has no copay, then then deductible is $1,000 and co-insurance is 20%. How much will the patient pay? 20% of 1,000 or the total cost of the visit since the deductible has not been met? It's 20, sorry. If the deductible has not been met, the patient will cover the total cost of the visit. But if the patient has met the deductible, the patient will only pay 20% of the total cost of the visit, not the deductible. They will not pay the deductible. Like, for example, they have a 1,000 deductible. They don't have to like pay it upfront. Mamaminus ng mamaminus yon. Naguluhan ba? Naguluhan ba? Just ko, Lord.
I think what coach is trying to say is that deductible is 100% amount the amount that the patient must pay. And then tsaka lang after the patient meet the deductible limit, that's when coinsurance start to apply.
Okay,
I
let's
think.
say case 1, copay. Let's say copay. So the patient have a $20 copay. Okay? Once you hear, okay, again everyone, once you hear copay, they will automatically 100% covered after copay. Not unless they tell you there's a co-insurance or something or another like sort of payments. But usually if they give you the copay, they will give you, okay, you will like have the initial thought is gonna be 100% covered after copay. Now, once they give you a copay, they will also give you the out of pocket. Okay? Once the out of pocket has been met, they don't have to pay the copay anymore. Okay? It will be 100% covered. Okay? Mabilis lang pag copay, 'di ba? Case number 2. Like say co-insurance. Okay? And then the co-insurance is like 20%. Okay, meaning 20% patient responsibility. Now, there will be two cases, di ba? Deductible, let's say, the deductible is $500. Okay? Met amount, meaning, let's say met amount is $200. Okay? The patient will have to pay, let's say cost of service is 200. Okay? How much will the patient pay?
20% of 200.
200.
20%?
No, 200.
20% or 200?
200 because
200.
200
200.
200. It's because, okay,
the deductible hasn't been met.
the deductible has not been met. The deductible has not been met. All right? And then, okay, the next time that the patient will visit again the clinic, okay, meaning the cost of service will be 200, the co-insurance will still be 200 at 20%, but this met the since the last visit the patient pays 200, this will be accumulated to the deductible, meaning again um her accumulation for her deductible will now be 400 because she paid already 200 from the last visit. And then today, the patient, okay, will again be seen at the clinic for the cost of service 200. How much will the patient pay?
The patient will pay
100.
100 first and then pay 20% of the remaining balance.
Very good. So the patient will have to pay $100 first because that's the amount that she needs to pay to meet her deductible. Once she pays $100, then the met amount, okay, since this will be counted, will become 500. And then since na-meet niya na yung deductible, she will cover 20% of the cost. But since she already paid $100, 20% of $100. All right? Gets? So that's how much? 120? 140? 140? Ba yan? Ano ba? Ano ba talaga? 20% ng ano 20. 120 lang daw pala. Sorry na. Alright, 20%. So meaning the patient will have to pay, 120. Alright? Okay. And then another case. Okay, since the patient has already met his or her deductible, okay, how much will the patient pay?
Only the 20%.
Only the 20% of the cost of service, which is how much? $40?
Yes,
40
200.
dollars.
Yes.
Getsung? Okay, medyo naliwanagan na ba tayo? Alright, Getsung. Let's go. Alright, any other question? Nuggets? Nuggets, let's go. Okay, any other question? I have a duty na ng 9 p.m. So, any other question I can answer for you for today's video? Yes, I'm so sorry. Precious, getsung means gets. Like, you get it. You get the point. It's a like slang that we use. Slang. Or it's not slang. Is it slang yung getsung or like a Becky language? You know Becky, Precious? What's
Becky.
Becky means? It's gay
No,
slang.
please. No, please. I don't
It
know.
it's gay slang. So sometimes, gay people are like really fun and they have to like they mix and match. Mix and match. Like to help me out here. Like they modify some words and make it like fun or like make it um
Create their own
y-
language.
yes, they create their own language. So like we usually say gets, but for them like they say getsung, something like that. Okay, when will be the next schedule for the free webinar? It will be October 18. Same time, 7 p.m. Nagutom ako na Gemma. Hindi ko na talaga alam yung sasabihin ko. Wala nang natira. McDo. Yes, McDonald's. Do they always provide the met amount? Yes, they will always provide you the met amount. So you have to ask. Sometimes they don't. I don't know what's happening with our representative. Sometimes they don't. So you really have to know like the information that you need to get before calling. That's why I told you earlier, I have this guide that I use. Okay? You can also use this. This is very universal. Universal. This will help you a lot. This will help you remember what you need to get. Okay?
Sorry, Coach. This
Yes.
your outline for getting information. Do you
This
have
is
it?
like my guide.
Okay. Do you have it in an Excel? How do you do it, or you just write it on paper?
I write it in like my notes tab and
Okay.
then get just the benefits.
So once you're done with any patient, you delete it.
I input it to the chart. Like what you saw earlier in the cases, you have this. So I input it in here.
Okay. And then what the information in your notes, do you delete it or you just save it?
I deleted it for HIPAA.
All right. Thank you.
No problem. Automatic na kami dun, coach, or another registration. If you're registered, since we already have a record of your email, so we will send you an email. How often do we have to call insurance to verify? Um, Only when there's discrepancy of or is there a protocol of verification? Yes. Okay, there are facilities that will require you every visit, you'll have to get the verification of benefits. But for example, for this patient, Andrea, you'll see here that she's covered $25. Okay, and then you'll see the out of pocket is only 2,500 and the met amount is $5.95. So it's still like a long run or a long way to go that you don't have to verify. It's because you know that person hasn't met his or her out of pocket or deductible. Also in portals, there would be delays because sometimes previous claims hasn't been processed. Yes, that's why most clinics prefers to use calls instead. It's much accurate than the portals. All right. Any other question? I'll give you another 6 minutes. So it's currently 8:34. I'll give you another 6 minutes and then I'll have to end the session. Take a rest for 20 minutes and be back working. A brief summary for out of network coach, please. Okay, out of network. So if the provider or if the insurance representative like give you an out of network benefits, okay? Um it will be the same process. It's just different coverage. So let's say for example, okay. So sometimes there are plans that does not have an out of network benefits or coverage. If that's the case, it's either they'll have to pay out of pocket or they can find a provider that is in network. So that's why this is my first step. Okay, knowing whether we are in network or out of network. Let's say for example, okay, the other one is out of network. OON. Hmm, Ayaw niya. Ayaw niya mag-caps lock. Ayan. OON or out of networks. And then the policy, of course, it will start the same. Say for 1/2021. Okay, up to present is because still covered up until today. Okay, up to present. Okay, of course, that doesn't mean it will still be the same here. It's the same coverage. Okay, so for in-network benefits, let's say that patient have $70 30% co-insurance, meaning that patient is 70% covered after copay. And for out of network, the thing that you need to remember when it comes to in network, okay, meaning they are in the network, they are participating, they have lesser rate than the standard, so they have a contracted or a discounted rate. Okay, so for in-network is usually much lower than the out-of-network. Let's say this one is 30%, okay, coverage niya. Sorry, this one is not. Since the representative gave me like a co-insurance, I'll know that the patient doesn't have a copay. And then co-insurance directly connected with your deductible, I won't have to get the out-of-pocket. Okay, and then they will tell you 500, okay, and the like accumulation is 100. Okay? So sometimes when the patient gets seen with an in-network, it doesn't mean that the same deductible will apply to the out-of-network. Okay? They will tell you, okay, 50% covered after, sorry, mali pala. Deductible. Okay, and then for out of network, they will tell you 50% covered after deductible. Okay? So, ibig sabihin, co-insurance will be 50% patient responsibility. Okay? So, sometimes, once you get the in-network benefits, they will tell you $500 is the deductible. That doesn't mean that your deductible for your out-of-network will be the same. Usually, it's much higher. It's like $100,000. It's not the same. Okay, and then for example, the accumulation here is 400, but it's for the same patient and it's for the same policy. It's just the one is in network, the other one is out of network. Of course, it will be the same payer ID, same authorization, same call reference number. Okay, the only difference is that for out of network, it's either not covered or if it's covered but for a higher fee. All right. No problem. Any other question? Okay. Thank you so much, everyone. I hope you learned a lot today. Okay, and I hope I see you on the next training. Next webinar or next training. So our next training, batch 16, will be starting 14th, October 14th. And for the free webinar, it will be next Friday, which is the 18th at 7 p.m. Among next webinar natin, it's about yung webinar natin. About common patient increase. Easy. That's easy for you guys. Okay, no other question. Thank you so much. What time po training sessions? If it's for the medical VA, the calendar is already posted on our page po, no? Kasi different time schedule siya. Since we do have a lot of courses this October, meron tayong home health course and Oasis, and patient care coordination, and your mental health. Coach, I would love to chat with you privately. Sure, Precious. Just send me a message. My replay, yes, there will be a replay. I will post a video on our YouTube channel. You're very welcome. And I love seeing familiar faces, familiar names. Thank you so much for rejoining, even though you already know this information. No problem. Thank you so much, everyone, and I hope you have a great night. You sleep well. For those who will be working, work well. Work, yun lang masasabi ko sa inyo. Happy Friday for those who will still be working the night shift. Yes, diretso na tayo sa shift natin. For the English na naman tayo sa ating mga for the client. Tulog muna sa wala pang client, no? Maximize nyo yung tulog nyo. Bala kayo dyan. Pagdating ng client nyo, wala na kayong tulog. Wish nyo na lang sana wala na. Matulog na lang ako. Alright. Okay, what is tulog? I don't know. I don't know what's tulog, Sevi. I think it's like some sort of candy. No, just kidding. Wala tayo niyan, Sebi. Huwag tayong mangarap ng ganyan. Alright. If you guys have no more question, you can leave the room or I'll leave the room na lang as I know you won't leave the room. Bala kayo dyan.
Thank you, Coach.
Thank you so much, everyone. Bye.